clinical nurse, and he wants me to do an assessment of your eyes, ears, nose, and mouth. So I'm going to perform several tests today, and then I'll report my findings to him before he examines you. I want to start with looking at the Snellen chart there in front of you. I want you to take this and cover your right eye and read me the smallest line of letters you can read clearly.
F, C, Z, D, E, P.
Very good. Now cover your other eye and read the same.
F, C, Z, D, E, P.
Good. I take it you don't wear glasses or contacts?
No.
No. Okay. Excuse me. And your vision is 20/20. Now I'd like to check your fields of vision. I'm going to move my finger to the side. If you would just look straight ahead, but tell me when you can see my finger wiggle in your peripheral vision.
No.
Okay?
No. No.
And you just
No.
look straight forward. Alright, now if you could look at my stick and keep your head still and just follow the stick with your eyes. Okay, you have good accommodation. Okay, next I'm going to take a look at your eyebrows. Here's even. They're symmetrical. Don't feel any lumps. Don't see any redness. See no edema or swelling. You haven't felt any lumps or nodules or around your eyes.
No.
I see no flakiness, no redness. Take a light and look into your eyes. Just look straight ahead at me. I'm looking to see that your pupils react simultaneously and evenly. Look above your eyes. I want you to look down, please. Checking the square of your eyes. Look up. Okay. I see no tremors in your eyes, which could be a sign of hyperthyroidism. Your eyelids look even with no inversion or eversion. If you didn't have the whites, if you had any yellow or green color to the whites of your eyes, it could be a sign of liver disease. Your cornea looks clear. Now, if there was an arc or a circle there, it could be a sign of hyperlipidemia. Your pupils are equal in size at 3 millimeters. They react equally. I'm going to check a reflex, so I'm just going to touch this to your eye. Keep your eye. Look straight ahead. Okay, blinking is a normal response. Feel your eyelids here and check your lacrimal gland. If it would be full, that would mean it was enlarged, but it's not. Check your sinuses. I'm going to dim the light in the room a little. And look into your eyes with the ophthalmoscope. If you could lean towards me, please. look at the clarity of the lens. And I'm going to check to make sure if their red reflex is absent. You could have cataracts, or there could be a hemorrhage of vitreous fluid. Your retina should be yellow with a reddish pink background. I'm going to look at your blood vessels and make sure nothing looks abnormal. Your optic disc should be yellowish to creamy pink. Okay, so just look straight ahead. Okay, now look straight into the light. Check your macula. Now, I'm going to check the depth of your anterior chamber, and if there's an area that the iris is not lighted, it would indicate that you have a risk for acute angle glaucoma. Nothing abnormal. Turn the lights back on there. Next, we're going to do an examination of your ears. Turn your head. Check the oracles there. The position symmetrical. Do you have any tender areas on the outside of your ears?
No.
You noticed any swelling?
No.
Any drainage?
No.
Okay. We'll take a look. Okay, we'll pull up and back on your ear a little bit. Your tympanic membrane looks pearly gray. There's no redness, no lesions, no ceruma, no wax. Look in the other ear. Good, no abnormalities. Take that. I'll wash my hands. Okay, I have a couple hearing tests we need to do. First, we're going to do the Rennie test. And I want to place this on the top of your head, and I want you to tell me when you can no longer hear the sound vibrating.
No.
Wait a minute. I don't want you to tell me when you can no longer hear the sound vibrating. I want you to tell me if you can hear the sound equally on both sides.
Okay. Yes.
All right, now the Weber test. We're going to check bone conduction and air conduction. Tell me when you can no longer hear the sound this time.
No. No.
Can't hear it?
No.
Now we're going to check the other ear. Tell me when you can no longer hear it.
No. No.
Okay, right ear saying normal. I'm going to check the left ear one more time. You should be able to hear it longer.
I have trouble.
Do you? Tell me when you can't hear it. was more normal,
I can get that right.
but you do have trouble with your left ear. Okay. All right, now I'm going to do the whisper test. I'm going to make noise in this ear and then whisper something on this side and see if you can repeat it to me. And try this side. Very good. Okay, now we're going to test your sense of smell.
Vanilla.
That's correct.
Cloves.
Yes. Now I'm going to look inside both of your nares. Light here. This one. Take this. This is called a nasal speculum. I'm just going to put this in the edge of your nose. Making noise, no nodules, no lesions. I'll check the other side. Don't see anything abnormal in there. I do notice that your septum is a little deviated. Have you ever had your nose broken?
Yes.
That explains that. Now I'd like you to take and cover one nostril and breathe in. Okay, and the same with the other side. Okay, they're both painting. Any tenderness
No.
here?
No.
Okay. All right, I'm going to wash my hands one more time and then we're going to check your mouth. We're almost finished. Okay, first I'm just going to look at your lips. If you could lean towards me, open your mouth. Check your lips. Your frenulum is intact. Buccal mucosa, still no nodules. Good. Okay, now we're going to take a light. Look inside. Okay, nice and moist. Dorsum of your tongue is red, which it should be, not inflamed red, but red. There's no coating, no ulcers, and let's look at the bottom of your tongue or the ventral side. Okay, it's smooth with large vessels. The frenulum is intact. Everything looks good. Do you have any problem with your gums bleeding or anything?
No.
We'll look around in your mouth again. Good dental work. No teeth hurting.
Ow.
None loose. If you could stick out your tongue and then push it against the tongue blade. Okay, and on this side. Okay. Alright. Alright, now if you could clench your teeth or bite down and smile. Okay. That checks cranial nerve number 12. Now stick your tongue out again and say ah, and your palate rises and your uvula, and that is cranial nerve number 9 and 10. Also, the uvula is in the middle, and you don't have any tonsils.
No.
Okay. Try it one more time. Make sure there's no redness, no irritated redness anyway. Stick your tongue out. Keep it moist. All right, now I'm going to touch the back of your tongue, and it'll probably make you gag a little. Okay. All right. All right, that includes my sesame.